Today on Frontiers of Medicine, revolutionary brain surgery on a fetus. Join doctors in the OR during fetal surgery. It's an amazing story you won't forget. High-tech drug testing. A new supercomputer is stepping up the drug approval process. It's been a staple of Chinese diets for thousands of years. But now, doctors say this simple yeast may actually lower your cholesterol. Those stories and more on Frontiers of Medicine. Funding for this program is provided by the Medtronic Foundation, celebrating Medtronic's 50 years of pioneering therapies that restore health, extend life, and alleviate pain. Medtronic, when life depends on medical technology.
Welcome to Frontiers of Medicine. Spina Bifida is a birth defect that destroys young lives. But daring surgeons at Vanderbilt University are using a new technique with promising results.
Although it may not look like it, young Daniel Meyer is making medical history. Much like any other toddler his age, he likes to crawl, play in the yard, and ride in the car. But what makes Daniel so special is what potentially could have crippled him for life. Halfway through her pregnancy, Daniel's mother learned that her son suffered from spina bifida, a common neurological birth defect afflicting more than 1 in 1,000 babies born in the United States. Spina bifida results when the developing spinal column fails to close properly and becomes damaged by the constant exposure to amniotic fluid. The specific cause of the defect is unknown, although researchers point to a deficiency of folic acid in the mother as one of the key indicators. Spina bifida typically causes a myriad of health problems, from bladder and bowel dysfunction to paralysis to club foot. Daniel's parents, Scott and Corey Meyer of Mount Juliet, Tennessee, were devastated.
You don't know what you're going to do until you're faced with it, and
they couldn't give us a set, well, he's going to have this, he's going to have this, he's going to have this. It's going to be like, well, he could have A to Z here. He could fall anywhere in between.
At that time, there were only 2 options: abort or continue the pregnancy, knowing that the child would be born with any number of health problems. While the Meyers were struggling with their decision, Corey's obstetrician-gynecologist gave them reason to hope for a third option. He referred them to nearby Vanderbilt University Medical Center in Nashville, where an innovative high-risk obstetrician named Dr. Joseph Bruner had been experimenting with fetal spina bifida surgery. It was a long shot, but to the Meyers, it seemed like a viable option.
Well, first of all, we had to decide that we were going to keep him. And once we decided that we were not going to have an abortion...
It was all downhill, really.
Yeah,
it was like, me personally, I put myself in his shoes, Would I want something like that done for me? And I felt, yeah.
Unfortunately for the Meyers, Dr. Bruner's ideas were still in the planning stage. The procedure had yet to be approved by Vanderbilt's Institutional Review Board. Fetal spina bifida surgery was still a largely uncharted territory, and even some attempts in the early 1990s using a closed uterus method had been unsuccessful. But the Meyers never gave up hope that Dr. Bruner's procedure would get the green light.
We pursued him. We were adamant about doing the surgery. Yeah. And then, because we were so adamant about it, I think he put everything together to make it work.
He helped get it pushed through faster, I think.
After several weeks of waiting, the surgery was finally approved. Dr. Bruner wasted no time. Corey Meyer needed to have the operation right away. The window of opportunity for optimal success between 22 and 32 weeks into the pregnancy was nearing its end. Soon the surgery was underway. Much like a cesarean delivery, Corey was administered 2 forms of anesthesia: a general anesthetic for both baby and mother, and an epidural for pain relief after the procedure. The combination of the two helped relax the uterus as well. Dr. Bruner describes the procedure.
We make the same bikini-type incision that a woman would get for a cesarean delivery. Then we take the uterus and we lay it on the mother's abdomen. We use an ultrasound then to map the contents of the uterus. And we actually take a magic marker and we draw the location of the placenta and where the baby's lying. Then we take a special hollow instrument we've developed and we put it through the uterine wall and drain most of the fluid. We then take a special stapling device. It makes an incision about as long as your finger. We put this device into the uterine wall, and when it cuts, it both cuts and seals the edges at the same time. Then we simply squiggle the baby up into the incision so that the spina bifida lesion is in the center of the incision. Then the pediatric neurosurgeon steps in and does exactly the same repair that would be done in a newborn.
Using Daniel's own skin, doctors close the spinal opening, sealing the spine against the harmful effects of the amniotic fluid. Once the repair work is done, the surgeons reinsert the amniotic fluid into the uterus along with an antibiotic to prevent infection. The incision is closed and the uterus is placed back into the abdomen. The surgery, and the more than 24 since, has been heralded a success. And to young Daniel, who bears the scars, a new quality of life has been granted.
The more that they test Daniel and they see how Daniel's doing, the more they say that they think he'll be able to do, Like now they're saying he'll be able to walk with short braces and they're always testing his bladder and stuff, and every time they tested his bladder's fine.
The outcomes of the babies that we've operated on is almost unbelievably good. And in the next 10 to 15 years, there may very well develop a separate subspecialty of doctors who will do nothing but operate on fetuses prior to delivery.
I think we've helped advance medical science, but I think Dr. Bruner did most of it.
I personally feel like there's always a gap there that
words can't express to the doctors, how you feel to them for what they've done for your child.
Since we first aired this story, doctors at Vanderbilt University Medical Center reached yet another frontier in fetal surgery, brain surgery. Here's the story.
For the first time ever, doctors have successfully performed brain surgery on a fetus. The groundbreaking procedure took place at the Vanderbilt University Medical Center earlier this year, under the guidance of Drs. Joseph Bruner and Noel Sullivan. The doctors have performed prenatal surgery nearly 50 times to correct a devastating birth defect called spina bifida. But in this case, tiny fetus Neil Borkowski was operated on to drain excess fluid on his brain. The condition, called hydrocephalus, or water on the brain, usually leaves children severely disabled and claims their lives within 10 years. The doctors opened the mother's womb and made an incision in the fetus's skull. They slipped a small tube in the fluid space of his brain. The opposite end of the tube was connected to a valve controlling fluid drainage from the brain and into the womb's amniotic fluid. While the jury's still out on whether Neil suffered any brain damage, he was born just 10 days later at a fighting 4 pounds 7 ounces with no fluid on his brain. Doctors consider the operation a success. And Neil's parents? Well, they're just thrilled to have their little bundle of joy.
Imagine testing new drugs without human or animal trials. One company in Texas isn't just imagining it, they're doing it.
For centuries, medical research has been a system of trial and error, action, then observation, until principles are proven. Dr. Frederick Hauschier, a San Antonio oncologist, has started a company called Bionumeric. Their goal is to work on discovery of new drug therapies in a faster, more efficient manner. While other labs are using test tubes and petri dishes, Bionumeric conducts its experiments using two Cray supercomputers that can process 26 billion calculations per second. The idea of using computers to perform experiments was first suggested to Dr. Hauschier when he was doing cancer research at Johns Hopkins University, and the nearby National Cancer Institute purchased a Cray supercomputer.
In 1985, when the National Cancer Institute purchased the first supercomputer, which was dedicated to biomedical research. And so I was just down the road in Baltimore, and my advisor and some of the faculty there that were my mentors said, "Hey Fred, why don't you go down and see if you can do something useful?" Because they knew I had some familiarity with this, and fortunately I was able to go down there and got to work on this Cray.
Because using this method of research was unproven, the Institute was not ready to fully embrace it. So in 1992, Dr. Hauschier decided to start Bionumeric to conduct more advanced research on computer drug discovery.
You have to persevere. I think anything that's worthwhile, particularly if it's never been done before. I had a lot of people telling me, you know, Fred, this is a great idea, but nobody's ever done it before. And you know, I just didn't let that bother me.
The supercomputers allow scientists to simulate drug therapies at the molecular level rapidly and repeatedly, which means they could potentially reduce the need to conduct animal testing while speeding the FDA approval process. The simulations are created using a special software package designed for Bionumeric by a university collaborator, Lawrence Livermore Labs. Not only can the computer models test how the drugs will react with the cancer they're fighting, but also how they will react to the other systems in the body. This allows potential side effects to be addressed before they are created. The overall method shortens the process from several years to several months. It also creates a drug that is better engineered for patients.
And you try to come up with, what do we want this drug to do? What would it say on the label? And what would people look at it and say, is it novel? Is it safe? Does it really work? Is it more potent? Going over those things and starting from the patient and the disease and work yourself back down into the natural history of disease, and then further down, and is there a molecular basis for that natural history of disease, and then further down, is there an atomic molecular interaction that we can modulate? And then you solve it in the forward direction. That's a lot different than if you have, hey, we're going to make a buckyball and then we're going to go find out what it's good for.
Bionumeric's first drug, BNP 7787, works by inactivating certain toxic species of cisplatin and carboplatin, two already widely used chemotherapy drugs. By eliminating these certain toxic species within the drugs, side effects such as nausea, vomiting, bone marrow suppression, and various organ damages are also eliminated. Even though the side effects are gone, the drug's efficacy in cancer treatment remains intact. In fact, because these side effects are gone, a higher dosage of the drug is tolerable to the patient. This allows use of dosages that previously would have been lethal to the patient with fewer side effects. Preclinical animal trials show a 50% jump in remission rates with a 100% decrease in mortality. BNP 7787 is currently in phase 1 human clinical trials in the United States. While Dr. Hauschier is happy with the progress Bionumeric has made with BNP 7787 and computer drug testing as a whole, he is continuing to push the company to find more cancer treatments. That's because he has a very personal reason for fighting cancer that dates back to his childhood.
I was very close to my grandfather, and he was a real funny guy, and really enjoyed him when I was growing up. And he developed, cancer, and he died of it when I was about 8 years old. And I watched what happened to him. I have a very strong memory of that. And I think, I was thinking then is I'm going to do research on this disease. And I want to be a researcher and a developer of, things that might help patients with this problem.
If Dr. Hauschier has his way, no child will ever have to lose a grandparent, parent, sibling, or friend to cancer. And the cure for the disease won't be coming from a test tube, it will be from a silicone chip.
Still to come on Frontiers of Medicine. It's been a staple of Chinese diets for thousands of years. But now, doctors say this simple yeast may actually lower your cholesterol.
There's new relief from arthritis aches. A newly approved class of non-steroidal anti-inflammatory drugs are providing pain control with reduced side effects.
Painkillers like aspirin, ibuprofen, and naproxen are called non-steroidal anti-inflammatory drugs, or NSAIDs for short. Although these drugs are helpful in both relieving pain and inflammation, heavy use of them can lead to harmful side effects, including ulcers and other damage to the lining of the stomach. People who suffer from arthritis are particularly vulnerable to the side effects of NSAIDs because they often use these painkillers daily. Since an estimated 19 million Americans suffer from arthritis and another 20 million from other acute pain problems, the pharmaceutical industry is interested in discovering an alternative to NSAIDs that would carry fewer side effects. This is especially important when you consider that each year more than 100,000 people in the U.S. are hospitalized with NSAID-induced gastrointestinal problems. There are more than 16,000 NSAID-related deaths each year in the United States. In the past few years, a new class of anti-inflammatory painkillers has emerged that may help. Called COX-2 inhibitors, these drugs offer the best of both worlds: relief from inflammation and pain without paying the gastrointestinal price. One COX-2 inhibitor is called Celebrex. Developed by Searles, a division of Monsanto, it has been approved by the FDA for use on osteoarthritis and adult rheumatoid arthritis.
Clinical trials have demonstrated that Celebrex is an effective arthritis, pain, and inflammation treatment and shows a lower rate of stomach ulceration than naproxen.
It is thought that the new medicine works by inhibiting the COX-2 enzyme, which plays a role in causing pain and inflammation. But the twist is that it does so without affecting, of course, the COX-1 enzyme, the enzyme that helps to protect the lining of the stomach. NSAIDs inhibit both. Dr. Philip Needleman heads a team of researchers whose work led to the discovery of the COX-2 enzyme and to creating Celebrex.
The discovery of the COX-2 enzyme was really an awakening, because no one ever thought there were two forms of the same enzyme. And it taught us that one form is tied to the disease that arthritic patients have, and the other form was tied to the side effects.
Meanwhile, the pharmaceutical giant Merck has developed its own COX-2 inhibitor called Vioxx. It was tested for its ability to stop menstrual pain, or primary dysmenorrhea. For most of her life, Paula Engler suffered menstrual pain so severe that she would lose 3 days of work each month. This is a common situation. American women lose approximately 600 million working hours every year.
It's exhausting. You find yourself sometimes during the day just taking a deep breath and trying to relax yourself. I tended to want to stay home.
So Ms. Engler enrolled in a study of Merck's Vioxx.
In clinical studies, Vioxx was shown to relieve pain to the same degree and as quickly as commonly used compounds in the treatment of acute pain. This was seen to be true in patients treated with Vioxx for menstrual cramping, and also in newer studies in patients who were treated with Vioxx for post-surgical dental pain.
After taking one 50-milligram dose of Vioxx, dental patients who had their wisdom teeth surgically removed felt pain relief for over 24 hours. As other pharmaceutical companies race to produce their own versions of a COX-2 inhibitor, the American public may be on the crest of a pain relief revolution. without triggering such severe side effects in the stomach.
We all know the deadly effects secondhand cigarette smoke can have on you. But now, a new World Health Organization study shows just how pervasive the impact of secondhand smoke can be on the most vulnerable of all non-smokers, children. According to the report, almost half the world's 700 million children are exposed to tobacco fumes every day from 1.2 billion adult smokers. And it could get worse. The number of adult smokers is expected to increase by 25% in the next 2 decades, putting millions more kids at risk. Those children whose mothers smoke have an estimated 70% more respiratory problems, including bronchitis and pneumonia. For children whose fathers smoke, the risk of having health problems is 30% greater. In all, about half the early childhood cases of asthma, bronchitis, and wheezing can be attributed to exposure from secondhand smoke. The World Health Organization is now looking into a world treaty that would help slow the epidemic of smoking-related illnesses in children. They want world governments to look at issues including raising cigarette taxes, banning advertising, and providing the public with information on the serious health risks of smoking.
Could a dietary supplement lower your cholesterol? Chinese red rice yeast is showing some promising results. There's more in this report.
More than half of all Americans have cholesterol levels so high, doctors consider them at risk for heart disease. For many, it's the result of a bad diet or sedentary lifestyle. For others, it's just genetics or a combination of factors. But now there's a new dietary supplement designed to lower bad cholesterol called Cholestyne. It's made from red yeast rice, a staple in Chinese diets for thousands of years.
The typical patient that would be ideal for this Chinese red rice yeast supplement would be someone who's already trying a good diet and exercise, but they can't get their cholesterol level below 200.
A recent study from the UCLA Center for Human Nutrition showed that out of 83 people studied, those who received the supplement experienced a 15% reduction in their LDL or bad cholesterol levels.
This was a study of people with elevated levels of cholesterol, and what we found was that those taking the supplement compared to those taking a placebo had a 15% drop in their LDL or bad cholesterol levels.
Cholestyne came under fire last year when the FDA stopped its manufacturer, Pharmex, from importing its key ingredient, red yeast rice. The agency claimed that Cholestyne was actually an unregulated drug. Regulators said Cholestyne should fall under FDA domain because it contains a compound identical to a synthetic chemical called lovastatin found in prescription cholesterol-lowering drugs. However, a federal judge recently ruled that because the compound in Cholestyne occurs naturally in the red yeast rice, the supplement is protected by the Dietary Supplement Health and Education Act of 1994. Therefore, it doesn't have to be regulated as a drug. After a lengthy court battle with the FDA, makers of Cholestyne are careful not to claim that it prevents or treats any disease, but rather promotes a healthy cholesterol level.
This study suggests that taking Cholestyne as a supplement, in addition to a healthy diet and lifestyle plan, will be an inexpensive alternative for keeping cholesterol levels in a healthy range.
Cholestyne affects cholesterol levels by blocking the enzyme that regulates cholesterol production in the liver. With reduced cholesterol output, the liver then increases the absorption of LDL cholesterol from the blood, reducing LDL levels. The supplement has shown to be safe and without side effects.
Remember, the more information you have, the better healthcare consumer you'll be. A good place to start is our website, which has information about the stories covered by Frontiers of Medicine, plus links to other health information.
Next week on the Frontiers of Medicine. Diabetes. It's the leading cause of amputation in the United States and the 6th leading cause of death. For most, diagnosis means a dramatic lifestyle change. we'll look at the latest high-tech tools for managing diabetes. If you think the idea of growing real human skin in a lab is a little far-fetched, stay tuned. We'll take you where scientists are doing just that. If you hate your glasses, but you're not quite ready for surgery, these may be an alternative. They are vision correction implants, and they were just approved by the FDA.
Thanks for watching. I'll see you next time on The Frontiers of Medicine.
Funding for this program is provided by the Medtronic Foundation, celebrating Medtronic's 50 years of pioneering therapies that restore health, extend life, and alleviate pain. Medtronic, when life depends on medical technology.